5 things to remember about salmonellosis due to Salmonella Choleraesuis. Contrary to Salmonella typhimurium, Salmonella Choleraesuis is not zoonotic. Transmission usually happens from pig to pig, nose to nose, or fecal-oral. And healthy carrier pigs are really frequent because pigs can shed Salmonella even if they recover from the disease. Salmonella Choleraesuis affects weaned pigs, so nursery and growing pigs up to 5 months of age. The morbidity is pretty low. It is a pretty rare disease nowadays. It used to be very frequent in the 1990s, but vaccination is pretty effective and has reduced the prevalence of the disease. However, if we have a clinical case, usually the issue is death. Mortality is pretty high. The clinical presentation is usually sudden death due to septicemia with cyanosis of the extremities. So typically a pig will have blue ears, blue feet, a purplish blue abdomen. Diarrhea is pretty rare and that should be differentiated from Salmonella typhimurium infections. At necropsy, beyond the cyanosis, sometimes we can see the same lesions as Salmonella typhimurium in the intestine if the case is more chronic. But diagnosis is mainly made by culture on either fecal matter or the colon tissue, sometimes isolation on the spleen or the liver. That is not, I need to say that all over again.
Okay, whenever you're ready.
At necropsy, beyond the cyanosis of the extremities, the pigs will show a long and enlarged spleen, enlarged gallbladder and liver with some areas of necrosis. Sometimes icterus can also be seen in pigs affected with Salmonella Choleraesuis. The diagnosis is made by culture either from the intestinal tract of the pig but also from other organs like the spleen or even the liver, since Salmonella Choleraesuis is a septicemia. However, a positive culture, especially from the intestinal tract, is definitive of a diagnosis only if clinical signs have been observed. Treatment with antibiotics can be done, but sensitivities must be tested because a lot of antimicrobial resistances have been proven for Salmonella, either Choleraesuis or typhimurium. Modified allied vaccines are available and protect the pigs from clinical signs. They do not protect against infection, but they can protect the growing pigs from the clinical signs of the infection. Because pigs can shed for a very long time and the bacteria can resist in the environment, it's important to make sure that the cleaning and disinfection protocols of the barns are well done.